In this video, we'll discuss leadership support and specifically answer how managers can support employee mental health, when and how to use support skills, and review the Alone tool from the Connected certification course. We will also focus on how leadership needs to be proactive, not reactive, and then we'll end on how to put a resource list together. So if you're a leader or a manager and you notice a change in behavior of someone on your team, what do? How are you supposed to know how to address those concerns? Oftentimes, managers and leaders have said that they're not counselors. How can they possibly help? And it's hard to know where to start. Leaders must consider the following when supporting workplace mental health for their team. As a leader or manager, it's important to think carefully about your own boundaries and not overextend yourself. Don't take on responsibilities outside of your own training and qualifications. You're not a mental health professional or a counselor, and that's okay. So what happens when you notice someone is struggling and you want to approach them? Well, first remember to always validate what a person is feeling and remind them that it's a natural reaction to challenging events in life that are inevitable. I want to run us through and introduce the Alone tool. This is a tool that we developed for the Connected course and helps people learn how to support each other in a difficult situation. There are 5 actions that you can take to help someone from feeling less alone. Number 1 is to ask for consent and assess the risk. The L stands for listen without judgment. The O is to offer reassurance and reminders. The N is that you need to refer to professional help. And the E is to encourage other supports. So let's dive deeper into each one. A, ask for consent and assess the risk. So once you have consent, evaluate the situation for yourself and decide how you can best help. This does not refer to a clinical assessment that professionals use. The L is to remind you to listen without judgment. This is when you can bring your active listening skills into play. O is for offer reassurance and reminders. It's helpful to validate that person's experience and help counter any shame associated with seeking and accepting help for mental distress. Remind them that there are many options for treatment and recovery. N is need to refer to professional help and remind them that you are not it. Remember that each individual has a different need and the form of help is unique to that person and that situation. E is for encouraging other forms of support. For that person, that might include family, friends, or other elements of their community. In the same way as when you're in the workplace and you slice your hand, you don't expect your manager or leader to stitch you up. It is the same for mental health challenges. As a manager or leader, it's crucial to take a proactive approach instead of a reactive approach when it comes to workplace mental health. This means being vulnerable and modeling healthy behaviors. Supporting mental health means that you can model for your team your own self-care and boundaries. Another way is to build a culture of connection through check-ins. Intentionally checking in on each of your direct reports on a regular basis is more critical than ever before. Not just how are you, but specific questions about what supports would be helpful for them. And wait for a full answer. Use your active listening skills, ask questions. The third proactive approach is to invest in training. Now more than ever, it's important to prioritize proactive and preventative workplace mental health training for leaders, managers, and individual employees. A fourth proactive approach you can take is to put resource lists together. A resource list is a great asset and offers valuable support for your employees. So how do you do this? Well, first, involve your team when putting these together to make sure that you're addressing their specific needs. In putting a resource list together, it's also important to connect with organizations in your specific community that offer mental health support. And that can be for a range of topics, including depression, burnout, and more. Also, build a library of external resources with input from your team for both mental health and substance use challenges. And use staff training opportunities to bring in community organizations who support mental health. And lastly, don't forget to include mental and physical health benefits that are already included in your group plan on the resource list. The importance of workplace mental health education and skill building for restaurant managers and leaders cannot be ignored anymore. Leadership skills for increasing team well-being, performance, and productivity needs to be focused on when creating a more inclusive and psychologically safe workplace. We've covered a lot of topics and a lot of material. In these 5 videos, we've discussed top mental health concerns in the hospitality industry. We've covered the difference between burnout versus stress. We discussed substance use. We covered equity and inclusion, and ended on leadership support. These 5 videos are here to help you become better equipped and educated on workplace mental health so that you can make data-informed decisions. Learning how to foster equitable psychological safety in your workplace can help prevent burnout and other mental health challenges. Language helps us connect differently to topics, so expanding our vocabulary can help us expand our understanding and change our connection to ourselves and each other. Thanks for taking the time to expand your knowledge and understanding of workplace mental health in restaurants and hospitality. If you want to learn more and get certified, check out the Connected course by Not 9 to 5.